Hey guys, welcome back to my channel. So in this session, let's talk about arsenic poisoning in a very quick time. So arsenic poisoning basically guys, it is having three important types. So one is the fulminant type, which is the very dangerous one, which can cause immediate death of the patients, right? And it happens due to the ingestion of massive dose. For an example, 3 gram of arsenic. If somebody has been ingested that, so that can cause fulminant type of arsenic poisoning. So that is a very fatal one, uh, fulminant type, that is the arsenic poisoning, right? Now if we talk about the acute one, that is second type, it is having the two forms. One is the gastroenteric form and another one is the narcotic form. So guys, basically gastroenteric form can cause the diarrhea, which usually resembles the cholera, right? So because it might be having the rice water kind of stool presentation. Now on the other hand, we might be having the narcotic presentation also, where arsenic poisoning can affect the CNS and it might be showing the neurological symptoms in the patient, right? So it might be showing the neurological symptom in the patient. And gastroenteric form, if we talk about it, it might resemble the diarrhea, which might look like cholera, right? So to differentiate between the cholera and the arsenic poisoning is the very important thing over here, right? And the next one we are having, that is the chronic type of arsenic poisoning, and that is the most common type of arsenic poisoning, and usually the questions are coming from the chronic arsenic poisoning usually. So let's focus on to the chronic arsenic poisoning, right? So chronic arsenic poisoning is basically, it can affect any organ inside the body. So if it is affecting the skin, then you can see that it might be causing two kinds of presentation in the human body. So one, you can see that this kind of pigmentation might be appearing in the patient, right? As you can see that these kind of rashes are spreading over over the chest, and it might be spreading in any part of the body. So basically this is the raindrop pigmentation, right? This is the raindrop pigmentation over here. Okay, then here you can see that it might be affecting the soles of the patient, or it might be affecting the palms of the patient. Over here we can see that palms are affected over here, so it can cause the hyperkeratosis, right? So bilateral hyperkeratosis, as you can see in the picture. So in the skin category, it might be presenting with the raindrop pigmentation or the bilateral hyperkeratosis, right? On the other hand, if you talk about the nails also, these kind of lines I think you can appreciate over here, right? So these kind of lines you might be seeing them, okay, in the case of arsenic poisoning. So that is called as Aldrich-Mees line, right? On the other hand, if it is affecting the blood vessels, so it might be causing the gangrene also, right? So in some kind of chronic poisoning, you might be seeing the blood vessels involvement, and it can cause the peripheral gangrene over there, right? Now if it is affecting the hair, so you can see the hair loss might be seen. So alopecia might be seen in some form of arsenic poisoning. On the other hand, if it is affecting the nerves, it might be causing the peripheral polyneuropathy, right? So patient might be having the paresthesias kind of sensation. If it is affecting the bone marrow, then it might be causing the anemia, right? So these are the important organs which might be affected in the chronic form of arsenic poisoning, right? If we talk about the investigation, we might be going for the blood sample, or we might be going for the secretion sample or the urine sample, but among them urine sample is the best sample which you can rely upon. So more reliable sample, if you talk about, that is the urine sample, right? And if you talk about the treatment, then obviously we need to remove the exposure, right? So whatever is the source of the arsenic, right, it might be in the form of ingestion, or it might be form in the inhalational form, or anything else. So we need to obviously remove the cause over there, that is the exposure removal, and then we might be giving the chelating agent, for example BAL, which is a BAL or the DMSA, right? So that is the brief review about the arsenic poisoning. Thank you.